Are you over 60 and really focusing on your health, especially keeping up your strength and mobility? We've always been told that fruits are packed with goodness. But what if you've heard some whispers or maybe even seen some rather alarming headlines, suggesting that certain common fruits could actually be undermining your leg strength? That's a pretty unsettling thought, isn't it? The idea that something so natural could be harmful. Today, we're going to delve into these claims and see what's what. Welcome. It's a common belief that eating more fruit is always a good thing, particularly as we get older. And it's true, fruits are absolutely loaded with essential vitamins, minerals, fiber, and antioxidants, all incredibly important for staying healthy, potentially causing issues that could indirectly affect leg comfort and how well you get around. Now, it's really important we approach this topic with a sense of balance. This video isn't about making you afraid to eat fruit. Far from it. Instead, we'll look at 7 specific fruits that have been put under the microscope. We'll examine why they're sometimes flagged. Things like their sugar content, acidity, or other natural compounds. It's worth remembering that current science and major health organizations widely support eating fruit for its many benefits. The idea that these particular fruits directly weaken leg muscles in healthy seniors? That's not well established at all. Our aim here is to give you clear, nuanced information so you can make smart choices about what you eat, ideally with advice from your healthcare provider. First up, let's talk about pineapple. This tropical favorite is loved for its sweet and tangy taste and is often highlighted for containing bromelain, a mix of enzymes. Sometimes, concerns pop up about pineapple's natural sugar content and its acidity. Like all fruits, pineapple has natural sugars. For anyone needing to keep a close eye on their blood sugar, like those with diabetes, big servings of any sugary fruit could potentially cause unwanted blood glucose spikes. This doesn't mean it directly weakens muscles for most seniors, but managing blood sugar is certainly key for overall energy and health. Pineapple's acidity is another point that occasionally gets a mention. While the fruit is acidic, for most folks this isn't a problem. However, if you have a particularly sensitive stomach or certain digestive issues, you might feel some discomfort. But again, this isn't a direct path to muscle weakness. What about bromelain? Bromelain itself has been researched for various health effects, including its anti-inflammatory properties. One important thing to consider, though, is that bromelain can potentially interact with blood-thinning medications, such as warfarin. If you're a senior taking these medications, this is definitely something to discuss with your doctor. Such an interaction could increase the risk of bruising or bleeding, which might indirectly affect physical comfort. But this is a specific drug interaction, not a general effect on your muscles. It's also good to remember that pineapple is a decent source of vitamin C and manganese. So, rather than cutting it out completely, moderation and being aware of your personal health situation are the main things. The idea that pineapple inherently weakens leg muscles for all seniors? That's not really backed by solid evidence. Next, let's look at grapes. Grapes are a super popular, convenient, and tasty snack, full of various antioxidants including resveratrol, which is especially found in the skins of red and purple grapes. The main worry you often hear about grapes, especially concerning seniors, is their sugar content. Grapes do contain natural sugars. Much like pineapple, if you eat very large amounts, particularly if you're managing blood sugar, it could contribute to ups and downs. Consistently large blood sugar spikes followed by crashes can leave you feeling tired, which someone might mistake for muscle weakness. But this is more about energy levels than a direct hit on your muscle tissue. Another point sometimes brought up is the link between fructose, a type of sugar in fruits like grapes, and uric acid levels. It's true that a high intake of fructose can lead to increased uric acid production. If you've been diagnosed with gout, a condition where high uric acid causes painful joint inflammation, then managing fructose intake is a dietary consideration. Gout often affects joints in the legs, like the big toe and knees, and severe gout attacks can certainly mess with mobility and leg comfort. However, for most seniors who don't have gout, eating grapes in moderation is unlikely to cause problematic rises in uric acid that would lead to leg weakness. In fact, many fruits are generally recommended for gout patients because of their other beneficial compounds. Grapes also provide helpful plant compounds and are a source of hydration. The key, as with so many foods, is really about portion size and thinking about your overall diet and individual health, particularly if blood sugar management or conditions like gout are part of your picture. Mangoes, often called the king of fruits, are adored for their rich, sweet flavor and creamy texture. They're also a good source of vitamins A and C and fiber. Similar to grapes and pineapple, the main talking point when it comes to mangoes and senior health usually revolves around their sugar content. Mangoes are indeed one of the sweeter fruits, meaning they have a higher natural sugar content compared to some others. If you need to be extra careful about your carbohydrate intake, perhaps if you have diabetes or insulin resistance, large portions of mango could cause a noticeable rise in blood sugar. This can affect your energy levels, possibly leading to temporary tiredness after eating if your blood sugar isn't well managed. You might also hear the term high glycemic index linked with mangoes. The glycemic index, GI, measures how quickly a food makes your blood sugar levels go up. While ripe mangoes can have a moderate to high GI, the glycemic load, which also considers portion size, might be a more practical thing to look at. Pairing mango with foods that have fiber, protein, or healthy fats can also help soften the blood sugar response. Once again, the worry here is mainly about managing blood sugar for those who are susceptible, not about mangoes directly causing muscle tissue to break down or weaken in older adults generally. For most seniors enjoying mangoes sensibly as part of a balanced diet, they can be a delicious and nutritious option. The notion that they are broadly bad for leg strength for everyone over 60 is an overstatement not supported by comprehensive scientific evidence. Bananas are a hugely popular fruit worldwide, known for being convenient, affordable, and packed with potassium. They're often recommended as a quick energy source. When discussing bananas for seniors, two main points sometimes surface: their sugar carbohydrate content and their potential effect on uric acid levels, similar to grapes because of their fructose. Bananas do have natural sugars and carbohydrates, which, when you eat them, break down into glucose and give you energy. If your blood sugar is generally well managed, this isn't usually an issue. However, if you have diabetes or insulin sensitivity, portion size and keeping track of your overall carbs are important. Some suggest that a rapid rise in blood sugar from high-carb foods could lead to energy crashes or contribute to inflammation if it's a chronic, unmanaged issue. This could indirectly impact how you feel, but it's a complex picture and not a direct muscle-weakening effect. Regarding uric acid, bananas do contain fructose, which, as we've mentioned, can be converted to uric acid in the body. For someone with gout, this is something to keep in mind as part of their overall diet management. However, bananas aren't typically on the list of high purine foods that people with gout need to strictly avoid. In fact, some dietary approaches for gout are generally quite fruit-friendly. The claim that bananas significantly raise uric acid to a level that causes leg weakness in most seniors isn't strongly supported. It's also really important to highlight the good things about bananas. They are a great source of potassium, which is vital for muscle function, nerve signals, and maintaining healthy blood pressure. Many seniors might not actually get enough potassium, so for most older adults, bananas eaten in moderation can be a very beneficial part of their diet. To label them as a direct cause of leg weakness is generally inaccurate. Watermelon is such a refreshing fruit, especially loved in warmer weather because of its high water content. It's often seen as a light and hydrating choice. The main concern often brought up with watermelon for seniors is its high glycemic index and natural sugar content, even though it's mostly water. Because the carbs in watermelon can be digested and absorbed pretty quickly, it can cause a fairly rapid spike in blood sugar levels, particularly if you eat a lot of it on its own. If you're managing diabetes or your blood sugar levels, this is an important thing to consider. The potential energy crash after a blood sugar spike might then lead to feelings of tiredness or sluggishness, which some could interpret as weakness. Some stories also suggest that these kinds of blood sugar fluctuations can contribute to inflammation if they happen often and aren't well managed. Chronic inflammation is linked to various health problems, but directly tying moderate watermelon consumption to leg muscle weakening through this pathway in all seniors is quite a leap. On the bright side, watermelon is incredibly hydrating, about 90% water, and gives you vitamins like A and C, as well as the antioxidant lycopene. It also contains L-citrulline, an amino acid that might be good for blood vessel function. As with other fruits high in natural sugars, the key for seniors, especially those with blood sugar concerns, is moderation and just being mindful of portion sizes. Enjoying a reasonable slice of watermelon is unlikely to cause problems for most healthy older adults and is certainly not a direct cause of muscle decline. Oranges are widely praised for their high vitamin C content and are a common feature in many diets, whether eaten whole or as juice. The cautious notes sometimes sounded about oranges for seniors usually center on their acidity and, to a lesser degree, their sugar content. Oranges are citrus fruits, so they're naturally acidic. For some people, especially those with acid reflux, GERD, or a sensitive stomach, eating acidic foods like oranges, particularly on an empty stomach, might trigger heartburn or digestive discomfort. While this discomfort can be unpleasant, it's not the same as causing leg muscle weakness. What about sugar? Like all fruits, oranges contain natural sugars. Whole oranges also provide beneficial fiber, which helps slow down sugar absorption. Orange juice, on the other hand, doesn't have this fiber and can lead to a quicker spike in blood sugar if you drink a lot of it. For seniors managing blood sugar, whole fruits are generally a better pick than fruit juices. It's also been suggested that the acidity of oranges might irritate blood vessels or worsen inflammation. However, scientific evidence broadly supports citrus fruits for their anti-inflammatory compounds and overall health benefits, largely thanks to their vitamin C and flavonoids. Some specific compounds in citrus, like furanocoumarins found in grapefruit and pomelos, and to a lesser extent in some oranges, can interact with certain medications, including some blood pressure drugs, by affecting how they're metabolized. This is a valid concern if you're on such medications and something to discuss with your doctor, but it's not related to direct muscle weakening. Oranges are an excellent source of vitamin C, folate, and potassium, all contributing to immune function and overall health. For most seniors, oranges are a healthy addition to the diet. Green apples, like the Granny Smith variety, are known for their tart flavor and crisp texture. They're often seen as a slightly healthier choice compared to sweeter red apples because their sugar content is a bit lower. Concerns you might occasionally hear about green apples for seniors sometimes relate to their malic acid content and overall acidity. That tartness in green apples comes from acids like malic acid. Similar to oranges, the acidity might be an issue for individuals with very sensitive stomachs or acid reflux, potentially causing discomfort if eaten in large amounts or on an empty stomach. However, this is an individual sensitivity, not a general problem that leads to muscle weakness. It's sometimes suggested that this acidity could aggravate joint pain or trigger muscle tightness. While chronic inflammation can indeed affect joints and muscles, the idea that the natural acidity of green apples directly causes these problems in most seniors isn't well established by strong scientific evidence. In fact, apples in general are often included in anti-inflammatory diets because of their polyphenol content and fiber. While green apples are a bit less sweet than some other apple varieties, they still contain natural sugars. As with all fruits, this is something to consider for blood sugar management, especially if you have diabetes. But whole apples, with their fiber, are generally considered a good choice. The soluble fiber in apples can actually help moderate blood sugar absorption. Green apples are a good source of fiber and vitamin C, and provide various beneficial plant compounds. They can be a nutritious part of a balanced diet for seniors. The claim that they broadly weaken leg muscles or cause significant morning stiffness for most older adults isn't strongly supported. It's so important to emphasize that fruits, as a whole group, are overwhelmingly good for your health, including for seniors. They provide essential vitamins, minerals, dietary fiber, and a whole array of protective antioxidants and phytochemicals. Diets rich in fruits and vegetables are consistently linked with a lower risk of chronic diseases. Think heart disease, stroke, some types of cancer, and can support healthy aging. The fiber from fruit helps with digestion, can help manage cholesterol levels, and contributes to feeling full, which can be useful for weight management. The concerns we've discussed about specific fruits often boil down to a few things. High natural sugar content, mainly a concern for people who need to manage their blood sugar levels, like those with diabetes. It's about watching portions and overall carbohydrate intake, not necessarily cutting these fruits out entirely. Acidity. This might affect individuals with acid reflux or sensitive stomachs, but isn't a general cause of muscle weakness for everyone else. Specific compounds and medication interactions. Things like bromelain in pineapple with blood thinners or furanocoumarins in some citrus fruits with certain drugs. These are very specific interactions, not general effects. Uric acid. This is relevant for those with gout, but most fruits are not off limits, and many are actually encouraged. The idea that these 7 fruits broadly weaken leg muscles in the general senior population just isn't backed by current scientific agreement. Muscle weakness in seniors, sometimes called sarcopenia, is a complex issue. It's influenced by factors like overall nutrition, especially getting enough protein, how much physical activity you do, hormonal changes, and any chronic illnesses. Fruits actually play a positive role in a diet that aims to prevent such conditions. If you found this detailed exploration helpful and appreciate a balanced look at health topics, please give this video a like. We'd also love it if you'd subscribe to our channel and click the notification bell for more insights tailored for seniors who are aiming for a healthy and active life. We're really interested in hearing your thoughts. Were any of the points we discussed about these fruits surprising to you? Do you have experiences or questions you'd like to share? Please leave a comment below. Remember, sharing knowledge helps us all learn and grow. So while it's smart to be informed about how different foods can affect your body, especially if you have pre-existing health conditions, it's just as important to base your dietary decisions on balanced information and solid science. The 7 fruits we talked about, pineapple, grapes, mangoes, bananas, watermelon, oranges, and green apples, all offer valuable nutrients. For most seniors, these fruits can absolutely be part of a healthy and enjoyable diet when eaten in moderation and as part of an overall balanced eating plan. The notion that they are the main culprits in weakening leg muscles for most older adults is largely a misinterpretation or an overstatement of more specific concerns. Things like blood sugar management for certain individuals, specific sensitivities, or medication interactions. Real leg strength and mobility in your senior years are best supported by a holistic approach. A nutrient-rich diet with enough protein, regular physical activity, maintaining a healthy weight, and managing any chronic conditions effectively. Always chat with your doctor or a registered dietitian for personalized dietary advice, especially if you have underlying health conditions or are taking multiple medications. They can help you figure out the best way to include a variety of fruits in your diet to support your individual health goals. Thanks so much for watching. Stay informed, stay active, and embrace a diet that nourishes your strength and vitality.